of Africa Parkinson's Disease Foundation, based in Nairobi, Kenya, the first and only organization in Kenya of its kind. Okay. So Demystifying Parkinson's Disease is an awareness campaign we have been running in Kenya since the inception of the foundation in 2013. The goal is to unravel the mystery of Parkinson's disease. So when I first tried to register the foundation at the NGO Bureau in Nairobi, it was quite clear that my mission as a PD advocate was even bigger than I thought. This became apparent when my registration forms were first rejected, the reason being that the registrar's office did not understand whether Parkinson's was a person or a disease. So when I reapplied, I wrote a brief introduction of the disease and told the registrar that their lack of knowledge on the disease was the very reason we were establishing the organization. So that made it very quick for us to get registration. So our goal was mainly to educate the masses on Parkinson's disease, even if at that time I had no idea where to begin. So the overall objectives of this project is to, one, raise awareness around the existence of Parkinson's disease in Africa, with a key focus in Kenya and the East African region. Two, bring sensitization on issues and challenges faced by people living with PD, their families and caregivers, to address the issues of stigma and negative perception surrounding PD, to enhance the capacity of unskilled home caregivers, and of course, we also aim to increase the number of Parkinson's disease patients correctly diagnosed and registered with our foundation. So I wish to share with you some of the challenges we have faced as a foundation as we carry out this campaign, as well as the same challenges faced by the patients. So the first challenge we face is negative perception of the disease. In most rural areas in Kenya, people living with PD are viewed as outcasts since they are assumed to be cursed or bewitched. This I have experienced on a personal level because my father had PD, my late father, and despite the fact that we lived in Nairobi, an urban center, surrounded by what I'd call educated people, we faced a lot of stigmatization where our relatives and even our neighbors openly claimed that my mother had bewitched my father so that upon his demise, she would inherit his property. So this we experienced. So in most rural areas we have visited, people living with PD and their families are facing similar type of stigmatization. So the challenge of negative perception is worsened by the fact that there is no known cause or cure of the disease. Our next challenge is barrier to access to literature that is available on PD. So Kenya has no published information on PD, and we rely heavily on information provided by organizations abroad. The few who have previously heard about the disease in Kenya are either living with it or affected by it indirectly. Most people cannot access the disease information provided because of various communication barriers, one of them being, in this digital age, all information is just a click away. But for most people in rural areas, they have little to no access to these services. Internet is considered a luxury only for people in the urban centers and maybe for students. Then our efforts to disseminate information through print media have also failed in some regions due to low literacy levels. And then we have the challenge of translating available information into the numerous languages. This has also hindered our efforts to create awareness. Cultural practices. As is the norm in most rural areas in Kenya, patients often approach a traditional healer before they visit a modern facility. This is a major challenge in our campaign where traditional healers tend to be more trusted than us. So we've had cases where patients have actually, and their families have actually rejected what we have to offer in terms of information because it kind of differed from what they had been told by the traditional medicine men or women. Lack of skilled professionals. There are less than 20 neurologists in Kenya serving a population of 43 million. They are all based in the urban areas, and the fees charged for consultation are too high for most of the patients. This means that even as we deliver the message on Parkinson's disease, most of the patients cannot get access to the few professionals due to their location and also affordability. And for us as an organization, it means we have no professionals in the rural areas to help spread awareness. Poor or no access to proper medical care. Just like I have said, we have very few neurologists, and their location makes it difficult. So for example, one of our patients, Mr. Mohammed, lives in Moyale town. This is on the Kenyan-Ethiopian border, which is an average of about 884 kilometers from Nairobi. This gentleman has to travel to Meru town, which is 554 kilometers from his home, to visit a neurologist or even access medicine. This is the only time he has to learn about the disease he's living with or even interact with a professional. So the medications are also not readily available and are too expensive, considering that you need them continuously. Then the poverty levels. More than half of the country's 43 million people live below the poverty line. Poverty in some areas make medical needs seem like a luxury and not a priority. In some areas, there are more urgent needs to be met than the medical needs. For example, on our first visit to northern Kenya, we had to first provide food and water before we could even state why we were there. So that's also a challenge for us. So the next one, lack of government support. I think this is shared by most developing countries. So in Kenya, our government spends most of its funds on healthcare, on programs that touch on HIV, AIDS, malaria, maternal health, and cancer. So neurological disorders, like many other areas, tend to play second fiddle to these programs. This means we have no access to any government funding for the awareness campaigns. So though the road has been full of barriers and major setbacks, we have managed to achieve some level of success, and some of the measures we have taken to ensure the success of our program include: one, we have done community-based awareness campaigns. So this we have done through we have tailor-made our campaigns to fit into every cultural system of each targeted community. This is by individual home visits, the use of translated literature where possible, and of course, recruiting translators from the community. Two, we have integrated the traditional healers into our sensitization program. Through proper training, traditional healers have actually helped bridge the treatment gap and have also helped assist with the lack of trust in the communities. Since they are highly respected in the communities, their added voice in our campaigns makes the impact higher. We've done community engagement where our campaigns have had a higher impact through the use of public meetings called barazas, where people are called together by the elders or the respected people in the community, and we use that as a platform to communicate our message. So we've also successfully recruited volunteers, PD advocates who continue to create awareness in the community, even in our absence. By making the community feel that they own the awareness campaign, we are slowly changing the negative perception of PD and hence reducing stigmatization. We're empowering home caregivers through training on basic home caregiving skills and assisting them in home modification where possible. So this has helped improve the quality of care and support given to the patients. So 5, collaboration with local and international organizations. Locally, we are working closely with organizations that have well-laid and established networks within communities and those that complement our services. International PD organizations have been kind enough to supply us with information booklets and also walking aids. So some of the measures of success we have, we've managed to get more patients diagnosed and also speaking about it. We've managed to do the first PD support group in Nairobi, so hopefully in a few years we'll be able to report more groups in Kenya. We also managed to do the first PD Day last year, so this has become an annual event, and also we've managed to carry out training of unskilled home caregivers throughout. So that's one photo, a few photos of a home visit we did in Nyeri, Kenya. That was made possible through donations from the World Parkinson's Program. So as you can see in the last photo there, we still had to provide a bit of food for the family before we could donate the canes. That's our Parkinson's support group in Nairobi. So it's a diverse group, but it's slowly growing through the years. So we are grateful for this opportunity to share about our work in Kenya. And we hope we will overcome these barriers and Parkinson's will no longer be the mysterious disease in Africa. Asanteni.